All right, so why do we need sleep? I would first like to mention some of the benefits of sleep and the evidence as to its importance as indicated by various sleep experts like Matthew Walker, for example, a professor of neuroscience and psychology in the University of California, as well as a plethora of other studies. I will also cite all of the references that I use, and you can access the sources that I'll be using throughout the presentation. So we will talk about a lot of topics today. We will look at the impact of sleep on a variety of organs and organ systems. We will look at sleep in the brain, sleep and testosterone, sleep and aging, sleep and psycho-emotional well-being, weight gain, sleep in the metabolic system, sleep in the cardiovascular system. We will look at the role that sleep plays on the immune system and cancer, as well as the impact of sleep on the DNA. So, as you guys probably already know, sleep is crucial for memory and learning. In fact, students do worse in school if they don't get enough sleep, and there are actually more dropouts who don't get enough sleep. Sleep is especially important for better consolidation of memories. And not only that, but sleep is also needed to take in new information. In fact, a study showed that those who got 8 hours of sleep were 40% better able to form new memories than those who were intentionally awoken in the middle of the night. This had to do with a structure in the brain called the hippocampus, which is critical for memory consolidation, but then also gets damaged by a poor night of sleep. And in fact, a study by UC Berkeley also showed lower activity in the frontal and insular cortex when sleep deprived. And these areas are needed for decision making and social control, as well as moral insight. So being able to tell right from wrong. And it actually starves the brain of glucose, specifically these areas. And so, as you can see, it also interferes not only with memory, but also with other aspects of cognition. And also the ability to form new motor skills was actually 20% better. And insight to complex problems was 50% better with just one night of good sleep, showing just how important sleep is for all of these cognitive functions. And this actually has to do with the deep sleep waves and something called sleep spindles, which are produced during phase 2 of non-REM sleep, which we will talk about later. So, as we mentioned, sleep not only consolidates information and allows you to better remember things that you learned, but also allows you to acquire new information because now that you cleared up all of the old items from your storage space, you can take in new information. A study showed that men who slept 8 hours versus 5 hours actually had larger testicles. And in fact, those who sleep 5 to 6 hours per night have testosterone levels that are like those that are 10 times their age. In fact, one study showed that a 10 to 15% reduction in testosterone levels occurred after a week of sleep loss. And this is just so important because testosterone is such an important hormone. It's responsible for a variety of things, including libido, energy, and cognitive function. Dave Asprey and Sean Stevenson as well actually talk about the brain having its own lymphatic system, if you will, or waste management system that's called the glymphatic system. And this system detoxes the brain and clears amyloid plaques So a lack of sleep actually increases these amyloid proteins, which can lead to plaques and toxicity in the brain. The lymphatic system is actually 10 times more active when you sleep, as the brain literally shrinks to make more room for detoxification. So a poor sleep leads to waste buildup in the brain. In fact, research showed that all it takes is one night of poor sleep. And this clearly shows a link between poor sleep and cognitive related disorders like Alzheimer's, for example. In addition, sleep also affects your emotional state as well and increases your risk of all sorts of psychiatric conditions. Research done by Matthew Walker, which was released by UC Berkeley News, showed actually that a structure in the brain called the amygdala was 60% more responsive, and this overreactivity led to emotional instability during sleep. And Matthew Walker describes it as a sudden rapid change in your emotions and mood. And Sean Stevenson noted that poor sleep actually causes a more primitive, angry version of yourself. And a study actually found that a poor night of sleep leads to more arguments between couples that are not resolved. So it leads to these unresolved arguments. And poor sleep also increases your risk of developing obesity. During sleep, in fact, we have a hormone, leptin, which is a satiety hormone, which leads to fat burning. So poor sleep actually can lead to weight gain and obesity, as leptin is unable to do its function. It also increases another hormone called ghrelin, which literally is the hunger hormone, which make you hungry and give you craving, further increasing the risk for obesity. In fact, a study showed that those that have higher ghrelin levels are more likely to eat the following day. Also, Sachin Panda actually showed that insulin-producing cells in our pancreas have their own circadian rhythm, and it's not as effective at making insulin at night, which leads to a spike in blood sugar and then a hypoglycemic crash in the middle of the night that can keep you awake. So eating sugar at night may actually hinder sleep. It also suppresses leptin and can thus contribute to weight gain. In addition, as stated by Sean Stevenson in his Google TED talk, sleep is crucial for our appearance and body composition. A sleep-deprived group, for example, lost less fat and body weight than those that got enough sleep. Another study from the University of Chicago actually put patients in a calorie-restricted diet. And when these patients were sleep-deprived, getting only 5.5 hours in comparison to 8.5 hours of sleep, the individuals that got more sleep, so the 8.5 hours, lost 55% more body fat. That's a lot more. You can't even get that from doing high-intensity exercise, right? So sleep is so important for those that want to lose weight. And during the first part of sleep, we actually make growth hormone, which is anabolic in nature. And it leads to muscle building as well as fat burning. And so growth hormone is so important for building lean muscle as well as for burning fat. In addition, during sleep deprivation, excess cortisol gets released, which actually breaks down muscle tissue, but actually turns it into glucose. So gluconeogenesis. It breaks muscle and turns it into glucose, which actually leads to an insulin response and fat storage. So you literally hold on to that fat. So when you're sleep deprived, you're literally converting muscle into fat, so you're unable to burn it. In fact, you gain weight as a result. Melatonin, which is important as well, increases a type of fat. And by the way, melatonin is a sleep hormone that makes you sleepy at night, and its levels have to be high enough for you to be able to both fall asleep and get high quality sleep. So melatonin actually increases a type of fat called brown fat, which is metabolically active. And brown fat actually helps break down the white fat. And metabolic rate is increased actually when you have a higher brown to white fat ratio. So those that have performed regular and proper sleep hygiene have higher melatonin levels, and that is so important for fat burning. So staying up late at night is definitely not good for weight loss. Also, as mentioned previously, since the brain is deprived of glucose, right, and we talked about the insular and frontal cortex and other areas that are of the brain that are glucose deprived, they get less fuel, you literally crave more snacks to fuel the brain. And so you literally go for those potato chips or other unhealthy snacks because the brain needs more energy. And this is actually shown right here as well, right? So late night snacking and lack of exercise also suppress leptin and release, during the night. So avoid eating a highly caloric meal at night and avoid a sedentary lifestyle if you want to lose weight. And poor sleep actually increases ghrelin and suppresses leptin, as we mentioned. So you feel hungry and you can't feel satiated. And then, as we mentioned, your insulin response isn't as effective at night, and so you can get that blood sugar spike, which will keep you awake in the middle of the night. A lack of sleep also influences your metabolism in a negative way. Research actually showed that 1 week of poor sleep elevates your blood sugar to a pre-diabetic level. And in fact, another study showed that all it took is one single night, and how even that was enough to affect insulin resistance.